Yeah, that really helps. At least I didn't start my video yet. Or recorded. Hey guys, it's Manda the CMA here again. If you are a returning viewer, welcome back. If you are new to my channel, I talk about anything and everything medical assisting and beyond. Today, we're going to talk about why I chose the field of OBGYN. Now, there are so many different specialties out there, and sometimes you get a choice of what you get to do for your life, maybe for the rest of your life, maybe for a couple years. It depends. So stay tuned. Let's get started. Well, first of all, happy October. I love October. October is my favorite. Halloween is my favorite holiday. If it is your favorite holiday too, click that like button because, I mean, who doesn't love October? So when I was in school, there were two different fields that I actually wanted to go into. One was urgent care and the other was OBGYN. Now, why I chose those back then, I have absolutely no clue. I know that I do have a lot of viewers that are really nervous because they're not sure what specialty that they want to go into, and that's perfectly fine. There's no reason that you should have to pick that specialty before you go to school, during school, or even after school. I don't know why I picked those two. They just seem like an interesting and fun field to be in. Urgent care, you get to see a lot of different things, and I think that's what drew me to that, is just being able to have the experience of a lot of different experiences. And OBGYN, on the other hand, was women's health. If you've seen some of my earlier videos, I was placed at a oncology clinic for my externship, and I worked mostly with the gynecological oncology and breast cancer patients. And I think that's what really started me into the field, is I thought it was so interesting and there were so many different parts of the field. Just being at a cancer clinic, there were just so many things about gynecology that you could learn about, and that was only the tip of the iceberg. During my time on my externship, I really did look for OBGYN jobs, and I was lucky enough to get one right off the bat, which doesn't always happen. A lot of times your first job is not going to be your first choice in what you want to do, but you need to get the experience so that way you can go into the field that you really are interested in. So one of the reasons that obstetrics and gynecology was really interesting to me was that it's more of a happy medicine, for lack of a better term. So it's people that we're seeing throughout their pregnancy. They may have a couple issues along the way, but we get them through it anyway. It's people coming in for their annual exams. That doesn't go to say that it's always happy. Of course, there's going to be those people out there that can't get pregnant. We do infertility as well. So it's not always happy. You've got patients that can't get pregnant and you really wish that they could, but they can't. You've got people that have miscarriages, maybe multiple miscarriages, and it's really hard for them. So not to say that it's completely happy medicine. There are the downsides, but generally the OBGYN field is a more happy and upbeat type of specialty. They've done a study, and most women only have an OBGYN. They don't actually have a primary care physician. They choose to have their OBGYN as their primary since they go there for annual exams anyway. So those annual exams a lot of times is the only time that that patient actually sees a physician. They don't go to their primary care to have another exam. So we take over on a lot of things on that level. There are patients that we manage their depression, we manage their anxiety, we manage their thyroid issues that they might have. Usually if we go any farther than that, like a cholesterol or high blood pressure, then we send them on somewhere else, like a primary care. But a lot of times we're the only people that those women see throughout the year. and we tend to turn more into their primary. So I'm not only just getting the obstetrics and gynecology side, but I'm also getting a little bit of primary care as well with what I do. Another great thing about OBGYN is you're getting two different specialties for one. So you're getting obstetrics, which deals with patients who are pregnant, and then you get the gynecology side. So you're getting the patients that come in for their annual exams. Maybe they have uterine fibroids, everything that deals with the female reproductive organs. It could be anywhere from a breast lump to maybe they have a teratoma on their ovary or a dermoid cyst.
If you don't know what that is, you might want to look it up.
It keeps you really on your toes. There's a lot of different things that we do on both the obstetrics and the gynecology side. And you're really getting into two specialties at the same time instead of just usually one, like a primary care or maybe endocrinology or orthopedics. It's pretty nice to see that kind of mixture of different patients. So another reason that I like OBGYN is because you get all these small little practices in the suburbs. Now, the practice that I work at, we have probably about 75 employees and we've got 4 locations, so we're still technically pretty small. Our field isn't overrun with a lot of big corporations. You still have the chance to work for a smaller company. That doesn't tend to happen with like orthopedics. It doesn't happen a lot with urology. There are a lot of places that they just get eaten up by these bigger companies and you don't have the chance to work for a smaller company. Now, the reason that I like working for a smaller practice is because you get to know everybody a lot better. You're gonna know your administrator, you're gonna know the business office, you're gonna know medical records, you're gonna know the front desk. You get to know every single nurse and every single medical assistant that you work with and all the doctors as well. You get to have a really strong bond with all the physicians that you get to work with and everybody else. And I think that that's a really big thing, and that supporting a smaller clinic or smaller practice is really something that's valued just because of the way that they treat their employees. Usually they treat them a lot better than if you were with a bigger corporation. At my job, I actually get to use most of the skills that I learned when I was in school. So the only one that I don't get to use is doing EKGs. So I know a couple of you have said,
"Hey Amanda, why don't you do a tutorial on EKGs?"
Well, first of all, I do not do tutorials. I've said that a couple times. And the second reason is because I've pretty much completely forgot how to do EKGs. But we do urinalysis, we do blood draws, we do injections. We do a lot of different things, especially assist with in-house procedures. So we do hysteroscopies, we do tubal patency tests, we do a lot of different things where we need to assist the physician. So I do get to help with sterile tray setup. A lot of times when you work for certain specialties, you kind of lose the chance to do procedures if they don't do that many. So I'm really glad that with OBGYN you get to still do those procedures too. So I do kind of have a selfish reason of why I like OBGYN. The doctors in my practice do surgery and they do deliveries for their patients. So that means that they actually take time out of their work schedule to do their surgeries, and a lot of times they'll have to call and say that they're in a delivery and they're going to be delayed a couple hours, which means that we have to reschedule patients.
And then I have a little bit of extra time to do whatever I need to do.
Which is really nice because a lot of times you get swamped with paperwork and phone calls, or you're short staffed that day, and a lot of times it's really nice to hear that you have a little bit of free time or time to help someone else too. It's really good if you want to have a little bit of surprise free time. So hopefully you guys liked my video today, just a general video on why I chose the specialty I did. If you guys have any questions or comments, make sure you leave them in the comments box down below. If you are not already subscribed to my channel,
which I don't know why you wouldn't be,
make sure that you subscribe. You can also click the little bell button down at the bottom and you will get alerts anytime one of my videos comes up. And I think that's about it. So hopefully you guys are having an awesome fall already, and I will see you guys soon. Bye, guys.